Major depressive disorder, or known as depression. Scientists believe that depression is caused by changes in the limbic system, prefrontal cortex, hippocampus, and amygdala. They, however, do not know the exact pathophysiology of depression. All they know is there is an imbalance of serotonin and norepinephrine in the brain. Signs and symptoms of depression last 2 weeks at least in order for it to be diagnosed. They have either persistent sad, anxious, or empty moods, feelings of hopelessness, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in their hobbies and activities they once enjoyed. They have decreased energy or fatigue. They feel restless or have trouble sitting still. They have difficulty concentrating, remembering, or even making decisions in everyday life. They have difficulty sleeping. Either they have trouble not falling asleep fast enough at night, early awakening, or they oversleep, also known as hyperinsomnia. They have appetite and weight changes. Some people who experience depression have thoughts of death or suicide, or even have suicide attempts. They have aches or pains without a cause, and nothing is eased with treatment. Depression treatment, there's no one size that fits all, but the earlier the treatment, the more effective it is. Typical treatment is with medication, psychotherapy, or a combo of the both. It usually takes 2 to 4 weeks to become effective on medications. At the beginning of treatment, watch for increased risk of suicide because they will have an increase in energy, but the depression will take a while to lift. There's 3 different therapies that are used in psychotherapy. There's cognitive behavioral therapy, which is a short-term, goal-oriented treatment that changes the patterns of thinking or behavior. Interpersonal therapy is intended to be completed in 12 to 16 weeks that resolves interpersonal problems and symptomatic recovery. There's problem-solving therapy, which improves coping techniques to deal with stress. Electroconvulsive therapy is a last resort for depression when medications and psychotherapy don't work. The first line of defense with medications are cyclic antidepressants, or TCAs, which inhibit the reuptake of serotonin and norepinephrine. SSRIs block the neuronal uptake of serotonin. And the second line of defense are MAOIs, or monoamine oxidase inhibitors, which prevent the breakdown of serotonin and norepinephrine. A community resource in Springfield is NAMI.